Hey, what is going on, you guys? It is Isaac. We are back in the bedroom with another video, and today we're going to be talking about naloxone. So what makes me qualified to talk to you guys about naloxone? First of all, I'm in my last year of the Doctor of Pharmacy program at U of T, and second of all, I've probably given this talk about 20 or 30 times by now. This video is by no means a substitute for any kind of advice or training that you would get from your healthcare practitioner, so if you do intend to pick up a naloxone kit, make sure you get that training. So when it comes to naloxone, this is a type of drug that helps to reverse the respiratory depression and death that happens during an opioid overdose. Naloxone is available in two different flavors. You've got your nasal Narcan spray, which is my personal favorite, and then you've also got your OG injectable naloxone, which requires you to do an intramuscular injection. So like I said, I like the nasal naloxone spray a lot better. I find it's a lot more convenient and a lot easier to use for the majority of individuals. In the event of an overdose, timing is everything, and a couple seconds makes a really big difference when it comes to administering naloxone. So if using the nasal spray can save you a couple minutes, in my opinion, that's definitely worth getting the nasal spray. In addition, the nasal spray does not carry a risk of causing any needle stick injuries, which might increase your risk of contracting a communicable disease if you do end up getting a needle stick injury with the injectable naloxone. So now that's out of the way, let's get into the steps that you would take during an opioid overdose. The first thing you want to do is you want to see if the individual is conscious or not. So the way you do that is you'd yell their name, you'd rub their sternum with your fist, you'd smack the ground beside their ears and see if they're conscious, if they're breathing. If they're not conscious, you dial 911. And the reason why you do this is because although the naloxone kits are very effective at reversing an opioid overdose, a lot of the times there are other drugs mixed in there which might decrease the efficacy of your naloxone kit. On top of that, a lot of the time the naloxone kits only work for a couple minutes to a half hour. If that's the case, then you're going to want to make sure that the individual is at the hospital for further treatment. And lastly, a lot of people don't like to dial 911 because they're worried about having legal charges for possessing opioids or doing other drug-related illicit activities. Good thing for you guys, Canada passed the Good Samaritan Drug Overdose Act pretty recently. This is a type of law that protects you from any kind of drug charges that would occur in the event of an overdose. If you've dialed 911 to try to save your friend's life, the police are not going to crack down on you if that's the case. So once you've dialed 911, the next thing you want to do is you want to administer the naloxone. Whether that's the spray or the injection, administer it. There's almost no case where you would not administer the naloxone. The only case would be if the individual has an allergy or a severe allergic reaction to any component of the naloxone drug, which is very unlikely. So once you've administered the naloxone, you should start doing CPR on the person. If you're trained in CPR, you can do CPR. If you're not trained in CPR, simply put them in the recovery position, which I'll put up top. If it's been 2 or 3 minutes and the person is still not breathing, you're going to want to administer the second dose. If it is the Narcan nasal spray that you are using, make sure to administer the dose in the opposite nostril. With respect to side effects, naloxone is extremely safe. The biggest side effect you're going to want to be concerned about is the withdrawal effect that it causes. So naloxone knocks all the opioids off of all the receptors in the brain, which on one hand restores breathing, but on the other hand, it causes some pretty serious withdrawal effects. So the person that you administer the naloxone might be pretty angry at you once they wake up and they're in severe withdrawal. So now that I've talked about how you go about treating an opioid overdose, let's talk about how you use these specific devices. First one I want to talk to you guys about is the Narcan nasal spray. So this is what the Narcan nasal spray looks like. It comes in some packaging as well, which is really nice. You can see it is very sleek, very sexy as well. And what you want to do is you want to open this thing up. So it has this tag at the back, peel that off, take the device out, you stick it into the person's nose and you hold it like so. So middle finger and index finger on the top, and then thumb on the plunger. You press that plunger down and you've administered the first dose. The injectable naloxone is a lot more difficult to do. You got to know how to do an intramuscular injection. So I'll give you guys a quick demo of how you'd go about doing an intramuscular injection. All right, so I kind of just wanted to quickly show you guys how to provide an intramuscular injection of naloxone. This is something that a lot of people are intimidated by, but it's really not that difficult. It's pretty straightforward. So let's talk about preparing that first dose. You're going to have your dose inside an ampule. So you're going to have that first dose inside an ampule like this. You're going to take that plastic part, crack that ampule open, crack that sucker open, then put that ampule on a flat surface, like so. And this ampule has not yet expired, so I'm just going to save this, and I'm just going to pretend that this is the ampule. So I've just got some liquid in there. First thing you want to do, open up that syringe, like so. You can take that out, like there. Open up that syringe like so. You take off that cap, and then you've got that pointy part of the needle. Make sure that's pointing away from yourself because you don't want to stab yourself with the needle. So put that needle inside the ampule, and you're going to withdraw the full dose, which is going to be 1 ml. And you can withdraw some air as well, just to make sure you really get that full dose. So you have something like that. You've got some air inside of there, and you've got your full dose. Flip that sucker upside down. Push that air out of the needle, and you can flick it to get any of the bubbles out. Although, to be honest, injecting a little bit of liquid into someone's muscle, it's not going to be super harmful. So I wouldn't worry too much about that. I feel like a lot of people get caught up about that. So once you've got that dose loaded, you want to cap that again. So you can kind of see I've got my hand out of the way, and then I cap it like that. So I'm always trying to protect myself. You don't want to stab yourself with the needle. So then you have this lemon is going to be the muscle. If you're injecting it into the shoulder, you're going to want to landmark. I'll just show you guys a picture of how to landmark over here. So 2 fingers down from the acromion process, and then you make a triangle, and then you poke the needle right in the middle of that triangle. Alternatively, you could inject it into the thigh. So that's the outer part of the big muscle at the front of the leg. So you could put it there as well. So when it comes to providing the injection, you're going to want to first sterilize the place you're injecting. So just take your swab and just rub it on that muscle. Okay. Then you're going to want to take your dose like so, undo that cap. So then you're going to want to, hold that area where you're going to inject it, insert that needle at a 90-degree angle into that muscle, press that syringe all the way down until you've got the dose. And then you're good. And you can see in this case, it is spring loaded and the needle has retracted back into the syringe. So these syringes are really nice. You're probably not going to get a needle stick injury with one of these things. If you don't have one of these syringes, and even if you do have one of them, you're going to want to put them inside a sharps container. So in this case, we don't have a sharps container. I'm just going to throw it back to the naloxone kit, close that sucker up, and that's going to be our sharps container for now. So yeah, that's how you provide that intramuscular injection. If they don't wake up, give them a second dose after 2 or 3 minutes, and make sure you do not stab yourself with that needle after you provide the injection. That's going to put you at risk of contracting some kind of infectious disease, like hepatitis, HIV, whatnot. And if you do end up getting a needle stick injury after you provide the dose, you're going to want to go to the hospital, see a doctor, get a prescription for some prophylactic antiviral drugs to make sure that you don't contract HIV, that you don't contract hepatitis and whatnot. So you can see it's not super difficult. It's pretty intuitive, pretty straightforward how to provide intramuscular injection. Again, I do prefer the nasal naloxone spray because it is a lot easier. But if you're stuck, if you're having a quandary and you have to use the intramuscular injection, that's pretty much how you'd go about using it. Thanks for watching the video. That's pretty much all I had to say today. Couple things before we go. Just because you have a naloxone kit does not mean you should go crazy with the opioids. These don't always work. The efficacy of these depends on how quickly the person who is administering it acts. There are lots of unknowns. This is not going to protect you 100% of the time. So make sure you're still conservative with your opioid usage. If you haven't used for a while, start low and go slow. If you have the choice between using a pharmaceutical grade opioid and using a street opioid, use that pharmaceutical opioid and try to avoid using injectable opioids as well, since the pharmacokinetic profile from an injectable opioid is a lot more risky. Although it might feel better, it's a lot riskier to use injectable opioids compared to oral opioids. So thank you guys again for watching. If you found value in this video, make sure to hit that like button, hit that subscribe button, and hit that bell icon as well. I would really appreciate that. And yeah, thanks for watching, and I'll see you in the next video.